I'm Clara Dietl. I'm Associate General Counsel for Solution Health. So I provide general legal advice to our providers and staff. For families who are starting to have these end-of-life planning conversations, I would say make sure that you have all of your documents pulled together. The biggest issue that I see come up is that folks have not completed their advanced directives, and so they find themselves in a situation where they can't make their own healthcare decisions. In New Hampshire, the way that you can tell people what your wishes are for your end-of-life treatment is through an advanced directive, and that is comprised of two different documents. So the first is a durable power of attorney for healthcare, and that is a written document where a person would identify another adult that they would want to make decisions for them should the time come that they can't make decisions for themselves. So you don't need to be worried that if you complete that today, it doesn't take effect right away. It only takes effect in the future if your care team makes the decision that you can't make decisions on your own. The other part of the advanced directive is the living will. And so that is a document where you get to set forth what your wishes are for end-of-life treatment. If the situation arises that you can't make decisions for yourself, then the agent that you identified under the durable power of attorney is then going to look at the living will and see what your wishes were for end-of-life treatment. It's important to have those conversations often too, because your desires and your wishes around this can change over time. You know, depending on your diagnosis or your family circumstances, what you want today might be different a couple years from now. It's really helpful to have those conversations and to update your documents and your wishes over time.
My name's Jennifer Rydeen, and I'm a social worker with the Visiting Nurse Association of Manchester in Southern New Hampshire. Part of my role as a social worker is not only to talk about the end-of-life process, but to try to find ways to support the family and patient so that during this time things can be less stressful. There are different types of insurance out there that help when someone is on hospice. Many of our patients have Medicare, and that would be a primary source of insurance payment for our service. However, above Medicare, you may need help with caregiving or other types of supports. And for those who maybe do not have the financial means to pay for caregiving support in the home, there's the Medicaid benefit, which is called CFI, Choices for Independence. The program of Medicaid is something that we use for people who do want to remain in the home, in the community, and it provides them with block time caregivers, which is really important sometimes for folks who maybe have a limited support system. I believe that it's very important to start thinking and planning for end of life at any time during your life.
So it can feel overwhelming to think that you have to start making these end-of-life planning decisions, but there's really good resources out there that are available. For example, the New Hampshire Foundation for Healthy Communities, they have a really good guidebook on their website to kind of walk you through this process, and it's something that you can do on your own. You don't have to have a lawyer to help you fill out an advanced directive. You might want to consider getting a lawyer if you want to have a trust or a will set up, or if you need certain financial powers of attorney documents.
There's a multitude of other resources available that we do also use. ServiceLink, which is a New Hampshire-based resource center. They help with applying for Medicaid and other caregiving opportunities. The VNA website has several resources on it, mostly pertaining to bereavement support. We have a list of bereavement support groups that are available not only to the families of our patients, but to the community members at large.
The most important part of all of this is making sure that you both think about what your wishes are and then communicate those wishes to your loved ones and whoever you identified to make decisions on your behalf.
It's not something that has to be scary. It's not something that has to be hard. It's something that we can take ownership of and really make our own, which changes the whole feel of what we're doing in the time that we're here, and focusing on what's important with our family and honoring ourselves and our own wishes. You know, we're here with you. We're going to navigate this together so that regardless of what you have or what's available, we'll find a way to make this work, and we always do.